So for the next syndrome, we'll look at what is known as the Mayer-Rokitansky-Küster Hauser Syndrome. Alright, so it's quite long, but it's very important, So you just have to do the uterus. Okay, the uterus is not developing normally. Alright, so you could see the normal uterus, you could see the uterus that is affected by this syndrome. So the Mayer-Rokitansky-Küster Hauser Syndrome is a rare congenital condition that affects the reproductive system of what individuals assigned female at birth. So it's characterized by what underdeveloped uterus, or sometimes there's total absence of the uterus. So total absence. Okay, so can you see that here the normal uterus is bulled up, but this one is kind of like fading away, just to tell you that what those things are not there. So sometimes there's absence of uterus only. Alright, so sometimes also upper part of vagina, despite the person is having an external genitalia that is normal. Alright, but the person is not having these things inside. So what causes it? It's usually due to failure of Müllerian ducts to develop properly during fetal growth. Exact cause is not known, but genetic factors are always implicated. It's not linked to anything, okay, the parent did during pregnancy, so it's just genetic solely. So types of it is type 1, isolated presence of uterus and upper vagina, while type 2, you also have some issues in other organs. The organs can be present, but you have issues in them: kidney, the spine, hearing issues. So symptoms is such a person is not menstruating at the age of 16, but the breast is developing normal, pubic hair normal. Alright, possible difficulty or pain during intercourse. Okay, then type 2, you have the individual symptoms coming up from each organ that is affected. Diagnosis is pelvic examination, ultrasound or MRI to visualize internal reproductive organs, blood tests to check hormone levels. Then it's often diagnosed during adolescence. Treatment is vaginal dilation therapy, just to lengthen the vaginal canal. Alright, vaginoplasty, they can reconstruct the vagina, uterine transplant, okay, then psychological support. Alright, so that's just what this syndrome simply means. Okay, the uterus is not there, it's basically disappearing, so that's it.